and we bring on some of those protocols a little sooner. Like we use Dr. John's formulas from Darren Ingalls. We start to bring those in. Those protocols like Hutania, HHM, Hutania is anti-aspergillus. So some of the Lyme protocols are really effective because they're anti-mold. So they're really great to bring them in. They're also antifungal too, besides being anti-Borrelia. So it's really great to use all different kind of protocols, but detox has to be slow depending on the person. Sometimes, I pull mycotox and one person can tolerate a whole bunch of things, and someone who has an identical mycotox panel can't tolerate nothing, not even our probiotic, except for a little pinch. So I can kind of tell by how they respond, how bad and deep the dysbiosis is. And sometimes I can kind of tell too from their past history of what antibiotics they use. Like metronidazole will wipe out all the good stuff. They're more prone to have more sensitivities to everything and more salicylate allergies and also an intolerance sometimes to the azole groups. They're just so overwhelmed with other co-infections, really bad co-infections. So with detox, it's Krista's protocol is one of the best by bringing in protection first with phosphatidylcholine, appropriate mast cell stabilizers like quercetin and resveratrol if needed, getting the diet better and having them eat the whole rainbow of foods for vegetables, of course, if they tolerate them, but also the rainbow of supplements. So for fats, we'll supplement SPM and butyrine. I didn't show the full leaky gut protocol, but a typical leaky gut protocol, especially when they have any red zones on GI map, okay, or GI FX with like, salivary IgA, SIGA being elevated, or elastase being elevated or low, or calprotectin or zonulin, any one of these being high or low, extremely low or extremely high, it's problematic. So we would do a leaky gut protocol, and that would be kind of the crux of a lot. So it would be SPM with 4 to 8 capsules, then tributyrin, 4 to 8 capsules, our probiotic, if they tolerate it, 4 to 8 capsules eventually, and then mega IgG from microbiome labs, at least 4 to 8 capsules, depending on how severe their symptoms are. This will rapidly bring inflammation down. And then we added more protection for the mold detox. We want astaxanthine. It's an orange-red color pigment. Other pigments is like the blue-green, maybe blue-green algae sometimes, or chlorella for detoxifier if they tolerate that. Again, all of these can, if it's a binder or detoxifier, they can cause herx. So we go really low and slow. I'm not agnostic to different protocols out there. I think they're all great. I love the visual acuity tests, VCS, to just track the biotoxins and where they are in the mold. I keep in mind if they're dying off, like, okay, don't do a VCS because it'll look terrible. But when they're stable, like we can see some big shifts and improvements. And we also do the mycotox panel. We stick with one. There's many different brands out there, Real Time and Mosaic and other. I think there's a mold one with Vibrant Labs. Now they're all great. Just stick with the same one so you can kind of track how it's getting better. I didn't used to do this before, Lisa. I didn't used to provocate. I used to think mold was just a joke also. I'm friends with Dave Asprey for many years, over 10 years. I just didn't really ever believe it. But in the last 5 years, I've come to believe almost everybody has mold. Some version of it. I don't know if it's because we've been in the pandemic and isolated in one place and we breathe in all the mold in our homes and gotten worse. But I feel like it's a component, it's a part of every picture. And even when I go back to looking at oats from 10 years ago, there's a big fusarium and aspergillus marker lit up on everybody's oat. And our protocols work on all them. The CFO protocol does have activity for aspergillus and mold. So slowly, like I think people did get better, but I didn't used to do the full detox. So now we do all the protocols, coffee enema, castor oil pack for sure to pull the toxins out. Sauna, very safe sauna. If they're adrenally incompetent, we can't do that yet, but we eventually get it in very quickly if we can. Using binders a minimum of an hour beforehand. Now, if we're provocating, we don't do binders for 3 to 5 days and then collect the urine. We also do glutathione, at least a gram every day, every day for 3 to 5 days, sauna 3 to 5 days, and then collect the urine. That's a provocation. And then we could see truly what's going on. And it's amazing because I think people like who have maybe certain glutathione SNPs or CYP1BA SNPs, other SNPs for fat soluble toxins, they don't secrete.